Hello and good afternoon to everyone. Welcome to today's webinar. We are back to our Hannafin and Interpromote dual hosted webinars. It's been a little while. I know I'm excited. Eric's excited. This week we're going to be talking to you all about SEO and PPC strategies for the healthcare sector. I don't know if anybody really remembers, but we've started really trying to narrow down our focus for these dual webinars to discuss very specific industry-related tactics and strategies. And today we're going to be focused on healthcare. For qualification purposes, what we're talking about when we say healthcare is really anything in the healthcare sector or healthcare-related industries. So this could be education, insurance providers, actual hospitals or locations that provide healthcare services themselves. So kind of running the gamut of anything that gets its fingers dirty in the healthcare sector itself. So without further ado, we'll go ahead and get into introductions. Eric?
Hi everybody, and thank you, Kayla. It's great to be back having a webinar with you. My name is Eric Daffhorn. I'm the president of Interpromote, and we are an organic SEO and social media agency headquartered out of Cleveland. We've done a few things here and there that this slide talks about, but what I really want to say is I'm excited about this webinar because I am really 100% behind the drilling into specific vertical markets here. And while Kayla said that healthcare is a big industry, she's not kidding. The nice thing about this is we do talk about hospitals, we talk about physicians, we talk about insurance, we talk about everything, but the nice thing is this really does apply to more than just healthcare. The examples we use are in the healthcare industry, but the things that you will learn here can be applied to almost any business. So with that, I'll pass it back over to Kayla, and thank you all for your attendance today.
Great. So I'm Kayla Kurtz. I'm our Senior Digital Advisor here at Hannafin. Hannafin Marketing is a PPC management agency located in Bloomington, Indiana. I'm also a writer for PPC Hero, and I've done a little bit of speaking around the PPC and SEM world. So there's a little bit of that, and I don't like talking about myself, so we'll move on quickly. Perfect. So for today, we've got our topics split up into 5 little subtopics. So the first one of those is going to be how you can spot your online strategy vulnerabilities for your healthcare related brand. Then we're going to jump into allocating your PPC or SEO budget. That way you can avoid gaps, cannibalization among departments and things like that. We'll also discuss what the best ways are to measure your PPC or SEO campaign performances. I'm going to talk a little bit about some non-Google or Bing channels that you can use for paid search to more effectively saturate the market if you're in a healthcare related brand. And then I'll kick it over to Eric, and he'll discuss a little bit of information about how to run successful SEO campaigns with the continuously ambiguous organic keyword options that are becoming available. All right, so first up, we've actually got some poll questions that we want to ask everyone. The first one is, how long have you been involved in SEM? So we've got a few options here for you. We've got less than 1 year, 1 to 3 years, 3 to 5 years, and 5+ years. We'll give you guys a second to answer those. I myself would be a B person. I've been in paid search for 2 years and just a little over 7 months. Eric, what about you?
I started with Interpromote as a contractor in 1999, and around 2001 was trained on the actual organic part. Before that, we were doing some other online initiatives, but it seems like the better part of my life, even though it's not. So yeah, well over 10 years.
Awesome. Let's see. It looks like most people fall in my bracket, 39% at 1 to 3 years, but then the 5+ years is coming up not too far behind. So that's good to see. We've got some pretty wide spectrum of experience levels. All right, next up, another poll question. We like to keep these things interactive. When it comes to your SEM accounts, and you can talk to us about your PPC or your SEO or both, how is that being managed? The first option being that you manage it yourself. The second option, that you're a part of a team that manages it. Those are referring to more internal in-house management. The third is that you outsource your account management to an agency, maybe similar to an Promote or Hannibin. And the fourth is that maybe it's one of those, but you're also rethinking how that account is being managed. Obviously, the bulk of my experience is here on the agency side. Eric, did you do a lot of sort of freelance or consultant work outside of the agency atmosphere before joining Promote?
Yeah, I was more on the content side, freelance writing, editing, that sort of stuff. And so that's where it started.
Yeah, definitely two very different mindsets when it comes to managing these kinds of things in-house versus an agency. I'm seeing more of a hybrid kind of combination as of late. So that's interesting. And it looks like most people, about 52%, are part of a team that manages it. So that's great. So a lot of you actually have your hands directly in the accounts making changes. So hopefully we'll be able to spark some interesting ideas for you today that if you've not thought about them, you and your team can work on implementing moving forward. We'll stop with the interaction and let you guys sit back, and I'll kick it over to Eric to start talking about spotting your vulnerabilities with SEO.
All right, thank you. There are three main topics that I want to hit. And when I say vulnerabilities, what I mean is when you look at a lot of health systems or a lot of organizations that are involved in healthcare, what do we consistently see that we would categorize as opportunities? The first is local search. The second is doctors or other healthcare providers' presence and reputation. And the third one is at a much broader level, and that's at mergers and acquisitions. So next slide shows an example of a local search, and random query, random town, immediate care, Schaumburg, Illinois. I'm on my way out of the northwest suburbs, and bam, I decide I need to go see some immediate care right away. What do I do? Well, that is the type of question that Google sees more and more. You see a service and you see a geographic modifier on that. Now, what we see a lot is that organizations have not optimized for their local presence very well. The three big things you need to remember for your local search are the unique NAP. And what does NAP stand for? In the local optimization arena, that stands for unique name, address, and phone number. Because if that's what Google uses as a differentiator. When you have a facility that has its own unique address and phone number and name, then you are qualified to have a local listing. And I remember one of the reasons that's drilled into us so well is because, for a long time we were talking with stores within a store. For example, you'll have sometimes a Starbucks within a grocery store, and other things like that. And at the time, those did not meet the qualifications because they might have had a unique phone number, but they did not have a unique address. So you had to go about things differently that way. So that's what you need to keep in mind. If you have multiple locations with unique names, addresses, phone numbers, get those optimized. Another thing is correct categorization. I see so many very niche industries, niche businesses that are so poorly optimized on the local level. They'll call themselves a local business, or they'll call themselves an organization, and that is so vague. That's not enough. Google gives you so many different ways to categorize yourself, even within the healthcare industry. You don't just have to say healthcare organization. For example, and this is just a very, very short random sampling, there are specific categories for oncologist, neurologist, family practice, chiropractor, fertility clinic, fertility physician, fertility supplier, diagnostic imaging center, dental insurance agent, health insurance agent, emergency room, emergency care facility. Whatever it is you do, I am 98% sure that there is a category built for you, and you can categorize your business up to 5 different ways. So you could be a healthcare establishment and an emergency room. So be sure that you've kept up with what categories Google offers, as well as how many different ways you can accurately categorize yourself. You can do up to 5. And the third thing is keep your listings current. Add a photo, add a video, respond to comments. One of the things we really preach is you cannot keep people from leaving comments that are neutral or negative, but people assume that stuff happens. A bad review is not enough to tank your business as long as you've been out there and responded to it. Google has shown research that says a negative comment is mitigated and minimized with the rapidity and content of an organization who responds to it. So in other words, it's not the end of the world if you have a negative comment, but it is a bad thing if you don't get out there and address it right away. So all those things, all those ratings, all those categorizations go into how you appear on that local results page, and that's the first big vulnerability that we see. The next big one is physician search, and I'm not going to spend a lot of time on this because we've done a webinar on this already, and you can get it, you can see it at that tiny URL below. And don't worry if you don't have time to write this down, because you'll get a copy of this recording and notification when it's live. Physician search. How many times have you done a search for a physician? And the URLs that come up on top are often a full half page of things like health grades and vitals.org and things like that, and it's not the actual official URL of the healthcare system or of the doctor's practice or of the healthcare professional that you are looking for. And that can be very damaging. I have a friend who's an emergency room doctor, and he was just joking the other day about, you look him up and he, immediately he's worth 2 stars out of 5. And I asked him, well, what spawned that ranking? And he said, I don't know. There was one ranking, there was no comment, there was no name left. All it was 2 out of 5. Now the problem with that is these rankings are extremely arbitrary. That 2-star ranking might have come because a person had to park pretty far away from the emergency room. It might have come because at 3 a.m. they had to wait an hour to get in and they weren't happy about that. There are a lot of things that can drag a ranking down that have nothing to do with the level of care that a healthcare professional is providing. So that's important to know, and that's why this webinar that we link to here goes into how to ensure that your own official URL for a physician's name is much closer to the top of search results, because you have not only patients, but in this area with a lot of baby boomers retiring, you have lots of people searching for doctors who aren't necessarily the patient. Potential patients' children are searching for doctors and all sorts of things. So you've got to remember to make sure, if you're on the marketing end of a healthcare organization, that your healthcare professionals are taken care of in that sense. The third vulnerability that we see is due to mergers and acquisitions. Now this is a Google News search for health system merger. Okay, and Google News goes back about 30 days, so this is not the entire web. This is in 30 days, Google has noticed about 23,000 different news results about health system mergers. On this first page alone, it talks about 6 different mergers that have occurred or are occurring within the past 2-week time. Bottom line, health systems are being gobbled up, are being merged, are being subsumed by others, and a big opportunity that we see being missed is, the site assets changed. If one organization swallows another one, they all become that, and the branding just dies with the old one. We do a lot of projects where we will work during a merger or acquisition and help all those sites transfer their authority to wherever they're going to rest, wherever that new domain is, making sure that the local listings are updated, making sure that all the phone numbers get updated, because the last thing you want is someone calling, they've made the decision, they're going to go to you, but the phone number is no longer valid. So where they go next, to the next result on the search engine results page. So that's what we don't want. So those are the three of the biggest vulnerabilities that we see in healthcare right now.
Perfect. So that makes it my turn. When it comes to spotting your vulnerabilities for paid search, my very first step, and this may seem a little grassroots or maybe too basic for some of you, but it's my favorite, and that is to quite literally just type your company name or your service or product offering that you've got into a search engine and see what comes up. So for instance, in this one, I typed in Bloomington, Indiana dentist, and these are the top 3 dentists that come into play. Guess who's not on this list? My dentist, right? So now I have to go have the uncomfortable conversation with my very own dentist about how they're not necessarily being as competitive as they might want to be, but you can literally just type those kinds of things in, and if those first 3 results that pop up are true, really deep competitors of yours, that's a vulnerability. That's something that means you need to start getting a little bit more proactive about that approach. Even more so, and maybe even more specifically and importantly, is if you type in your true company name and you still see other results coming up, that means your competitors are bidding on your branded terms, which they can very much do as long as they don't use that term then in their ad copy. So you may end up with a situation where a searcher who's not quite as search savvy types in your company name and they don't realize that they're truly clicking on a competitor's ad, and then they end up choosing your competitor as their provider. So just something to keep in mind. I know it seems simple, but you'd be surprised how much you'd learn. And then my other big one from the PPC side of things, especially in the healthcare sector, is really just making sure you've got different conversion types for the different kinds of searchers you're going to get. I've said it before, I'll say it again. I think that the psychology behind the people who search online, the way those different people search, and what they anticipate the outcome to be once they close their browser down. That's all very fascinating to me because not everyone wants the same thing once they're finished with their Google search. So if your site's not set up to provide those different kinds of conversion opportunities, you run the risk of upsetting a potential customer, client, consumer, whatever the case may be. A quick example, I'm an IU girl, so I tend to use some IU Health representations, but IU Health does a really great job of providing all these different opportunities for a quote-unquote conversion. So obviously they've got an IU Health contact form. Very quickly over on the right-hand side, you can find that within a couple of clicks. They don't make it difficult. There are absolutely people who just want to go to the website and have someone from the IUH team reach back out to them. On the other hand, however, there are just as many people who would much rather dig around and they're just looking for information. All the way down to this self-diagnosis widget on the IU Health website, which I think is really cool. This is, that's a very different kind of searcher. That's someone who wants to potentially find the answers themselves versus the searcher who's going to fill out that contact form and wants someone to bring the answers to them. So again, just providing as many options as you can is going to be better than not. Eric, it's up to you.
All right. When we talk about allocating, yeah, I'm sorry, I was muted. When we talk about allocating budget, we mean budget not only in terms of dollars, but in terms of time and resources as well. There are several critical components that you should budget for, and I'm not going to say, hey, make sure this gets $500 and this gets $5,000 or anything like that. But the following things have to be accounted for. If you're doing this stuff in-house, you have to make sure this happens. If you are using a vendor, make sure that they are pitching this appropriately and have time allocated to all of these things, time and resources. The first one is architecture. We're very architecture heavy in our philosophy, and we say, look, all these changes you're making to the site, all this content you're adding, none of it is any good if you haven't taken time to make sure that it's crawlable and indexable reliably. Not only, can Google see all the URLs, can they crawl them efficiently? Are they a minimal number of clicks away from the homepage? But is there just one example of every URL? Duplication and near duplication is a real epidemic across enterprise level sites where we have 1,000, 2,000, 40,000 URLs. You might get, due to the way that dynamic URLs are set up, you might have 5 different URLs where there really should be just one. So making sure that the architecture is set up not only for the current site, but for the planned growth that the site will undergo is critical. Keyword research. People don't search for things the way they used to. They're changing it constantly as, there used to be a really large gap between what we would call doctor speak and what we would call patient speak. That's merging a little bit. But you still get a lot more people searching for high blood pressure symptoms than you do for hypertension symptoms, excuse me. So making sure that you are very familiar with how your prospective audience searches for things, you can't overestimate that because that is so very important. If we're talking about an organization that has multiple brick and mortar locations, you need to allocate some time towards the local feed, and not just the setup of the local feed. That's really one of misunderstandings we hit a lot is, well, you know, I have 250 locations, they're in there, go. Okay, I'm done with that. Well, you're really not done with that, because there is always a maintenance aspect that is not necessarily a full-time job, but it's a permanent job. And, you know, today, oh, this physician left, and tomorrow we're going to hire a new one, and her information is this, and his information was that, and we're not really focusing on this anymore. And some people complain because the pin puts us one block away from where we really are on the map, and we wondered if you can adjust that. And the pin sits on top of the administrative building where we really want the pin to be on the parking lot. And people keep calling this main switchboard, but they really should be redirected over here. And that's just a day in the life of someone maintaining a local feed. All those things happen, and when you multiply it times 20 or 50 or 200 or 500 locations, you have a lot of maintenance to do all the time. The next one is reporting. You know, all the stuff that you're doing is to no avail, to no benefit if someone's not watching it. And reporting and analysis, you know, sometimes are lumped together, but they're very different disciplines, because reporting is taking this data and presenting it, and analyzing it is different, because it's taking it and looking at it and say, hey, what worked here that we started doing 3 months ago, and what didn't work? And is it time to take the things that worked and propagate those throughout the site, and take the things that didn't work and shut that off, cut it off at the knees? So make sure there's plenty of time for data analysis, and so that you know what's working, what's not, and otherwise you're really just spinning your wheels. You're doing a lot of work and really not getting much insight out of it. So that's how we recommend allocating both time and financial budget on the organic SEO side.
Awesome. When it comes to the PPC aspect of allocating budget, it's really not easy to determine, and I'll be very frank about that. The reason why that is because typically speaking, when you're determining a way to allocate budget to PPC, it's the first time you've ventured into that market in the first place. So what you're essentially making a decision to do is either pull budget from somewhere else, or make an argument for the reasons why an additional amount of budget needs to be invested in paid search. So really my first notion about how to make that determination, whether you've dabbled in online paid advertising or not, is to first just look at those marketing channels you're utilizing that definitely aren't working anymore, and try to leech the money from there first. So I'm talking about some, and these can vary from, you know, healthcare niche to healthcare niche, but some of those more traditional print radio mediums, it's not a secret, and if you don't believe it, you're a little bit behind, I think, at this point, but online advertising is more than trumping and outpacing traditional mediums. So while that is not necessarily what people who are looking to that advertising are doing, that just says where the money is being allocated, that's happening because that's where people are looking more for their information. So if you want to be there, if you want to be front of mind, you really got to start making those decisions of pushing that budget, at least if not completely out of traditional, because there is still some areas where that works. You want to at least pull a portion of that over to your online marketing, and specifically into PPC. And additionally, the thing about those traditional methods is that a lot of them are not very easy to track. So the degree of trackability, short and long term, for PPC is a little bit, you've got a little bit more capability. So you can know in almost all situations, a click came from here or it came from here, that person then interacted again with our brand here, and then reached out with their information finally on this date and asked us to contact them. I found this interesting little screenshot online of this is what the internet looks like if you put it in the New York subway system. So you do have the ability to say, okay, they were on Google, and then they looked at our YouTube video and things like that, and do those multi-channel funnel analysis to determine really how often and how much interaction and engagement you're getting with your brand and your audience. Further, I think it's really important to note that at no point here are we saying that you need to go all in right now, today, and determine exactly how much budget you could max out into PPC. I'm not saying that at all. You know, if you've got the ability to pull a couple $1,000s out of a potential other medium that's maybe not working as well anymore, give that a shot. I found this octopus quilt, and at first thought that it was the goofiest thing I've ever seen, and then I realized it's the perfect way to illustrate how a PPC budget typically gets drawn up. And that's that each of those little different pieces of fabric that turn into this monster thing come from somewhere else. It's not usually just all one day somebody says, you know what, let's put $100,000 in PPC. Everybody ready? Cool. There's a lot more conversations that have to happen. There's a lot of more determination that has to go into it. And in that way, you end up pulling that budget from, generally speaking, a lot of different places in order to make those tests happen and then concrete your long-term investment in the medium. And then my final note is that depending on your exact niche, and specifically I'll speak to the insurance sector here, keywords can be a bit expensive on the PPC side. So every time someone clicks on some potential keywords, they're a little pricey. So for example, if your estimated cost per click on a keyword you want to bid on in insurance is $20 a click, and you set aside $1,000 budget, at max, you're going to get 50 clicks in a month. And you're never going to get enough traffic or momentum kicked up to really learn anything about the medium. So I would do a little bit of digging, find some estimates about potential keywords you want to bid on, extrapolate out some average click-through rates, conversion rates to see where you might be sitting. Don't forget that these are estimates. Very rarely have I ever uploaded a keyword list that I pulled from the keyword tool in Google and had those be the actual cost per clicks I was paying. But it is a good way to know what you have to invest, at least to allocate over and learn something about your medium. And then again, this allocating budget thing comes into play where if you are in a hospital or in an actual service provider situation and there are multiple departments, somebody needs to sit down and coordinate that conversation to make sure that Department A isn't bidding on the same keywords as Department B, and then you're causing some dual competition amongst your single sole hospital. So it's a lot of, yeah, there's not a hard way to say this is how you pull out a budget, but there are ways to do it, and it doesn't necessarily have to be all at once. So that brings us to our mid-webinar poll question. What methods have you all used previously to determine test budgets, either for SEO or for PPC? The first one being you quite honestly just guessed, and you can say that, a lot of us do, because it's a crapshoot anyway, right? The second, you hired a consultant to help you figure it out. The third being that you ran some estimates using online tools like SpyFu, the keyword tool estimator, and things like that. Or the last option being you use a combination of the two or more of the above options. Eric, talk to me about how you usually walk a client through setting aside a test budget. Is it, do they mostly rely on your thoughts? Do they do some experimentation on their own?
Typically, a test budget is for organic at our shop is based on what their history is. You know, a lot of people are coming to us now and say, well, we got dinged by this or we got penalized by that. So there's a period of time that we need to devote to the undoing of whatever is going on. But if not, we just use historical data and say, look, with a site like yours, we have typically achieved results within 3 to 4 months of this type of percent. And that's tricky. You know, we can never, someone asking me, what are we going to get out of this and how much and how soon is really one of the hardest things that we are asked. And so we estimate the best we can. We tell them that it relies on really rapid turnaround of implementation of what we recommend to them and say, look, we think that based on what we know about sites in your vertical and sites at your competitive level and your current traffic patterns that we can, you know, increase it by X% within 120 days, and we expect another, you know, another Y% within 12 months. So something like that. It's definitely a longer term outlook than PPC, just because we cannot turn things on and off. We, you know, anything we test, the test comes back within a couple of weeks, not within a couple of hours. So we're hamstrung there by the test of, you know, the sands of the hourglass. But that's how we walk them through it on the organic side.
Yeah, that makes sense. It looks like a lot of people who answered the poll use online tools. So those are things like the SpyFu, you know, checking out things like webmaster tools and stuff like that. And then the runner-up is that a lot of people are using more than one of the above, which is also good to see. I always say, even if you're going to use like those online tools, I always run my estimates off of 3, 4, maybe even 5, just to make sure that I'm getting a true potential scope or spectrum of the numbers. So good call, everybody, I think. All right, that takes us into the measuring for the bottom line portion. I'll kick it over to you, Eric.
All right, so how do you measure for the bottom line? Well, first, it's important to have a reliable analytics setup where you're making sure that everything is measured, making sure everything is coded and tagged. It's often surprising to see sites that, oh, we added these 50 pages in March, but oh man, I don't think the tracking tags went on there. So there's just a giant void of data right there. The other side of the analytics setup coin is goals. Okay, so not only do we need to identify goals and identify multiple goals if we can, but we need to put a value on them, whether it is based on likelihood that they're going to end up coming to your facility. Maybe it is an online appointment request, and over time you've gathered the data from 100 online appointment requests and averaged it out to what they ended up spending in your facility. Whenever you can put a dollar sign on a goal having been achieved, that's very, very important. And then from there, you can start to say, well, because you're segmenting all your traffic, I know you are, you can say, here's what PPC did for us. Here's what SEO did for us. And the next generation of that is, here's what a combination of PPC, SEO, and social media did for us, because multi-channel attribution is huge. We need to know, hey, yeah, the final click came from SEO, but it was because they clicked a PPC ad 3 days ago and they came back and they knew what to search for this time. So all those things are really working together, and you have to make sure, if you really want a clear picture of what your site is doing and how you're really performing, you need that multi-channel attribution. And the next even hotter is multi-device attribution. And you wonder why Google wants everyone logged into all their accounts on every device. Well, because people are doing things at the stoplight with their phone, on the couch with a tablet, and the next day at work. And so we want to be able to know, hey, what's the life cycle of a long complex query? Did they first do it on one device and complete the transaction on another device? And then once you start to mix the worlds of multi-channel and multi-device, you get it gets pretty complex. Ongoing refinement is also that we talked briefly about that in the analysis portion earlier. Don't just take the data at face value. Create data, create goals, create conversions, so that when you are able to look at that data, you can actually make decisions based on what it tells you. A lot of times, people have so much data coming in and they just look at it and they say, okay, well, great, I know this happened, but now what do I do with it? Okay, set up decision systems so that you can say, well, look, if this is under 25, then we're not going to do it anymore. If it's over 25, we're going to call it a success and we're going to spread that out. So this is really just a blowing out of the analysis portion that we talked about earlier, but those are the ways that you can help assign value to what you're doing on SEO. And share this with your vendor. If you're using a vendor, an outside vendor for SEO, they want to help make you money. Okay, a good SEO team is not going to be satisfied just sending you traffic, and they want a relationship with you. They want to prove their worth month in and month out, and you really have to think about these things and help that vendor help you by assigning your goals a certain value, so that you can really know month in, month out, has this work made me money, and is this vendor worth it? Otherwise, you're just sort of shooting in the dark and saying, well, we got this much traffic, we think we're doing well organically, but we don't have any extra phone numbers set up, so we're not really sure. You got to be sure, or else you're really sort of hamstringing your vendor and you're hamstringing yourself too.
Great. When it comes to the paid search side for measuring for the bottom line, I'm not even going to try to sugarcoat this. Generally speaking, healthcare sector related brands have somewhat long sales cycles. And that means that determining that true return on ad spend can be a little bit difficult and somewhat of a thorn in your side. A specific example of a client that we represent, P.S. How cute is that little baby? We have an EDU client that very specifically targets programs for students that are in the healthcare field, so nurses, doctors, things like that. For them, we can't just report on how many leads we got them, right? Like yes, that's great, but that's not our true determining factor of success. What we have to track for those clients is their enrollments. So how many of the original nursing program clicks turned into actual nursing program students? And that cycle can be 6 to 12 months and sometimes even longer. So, if the first click came, this is a little bit of a stretch, but if their first click comes in their first 12 months of living, right, we've got to track them all the way through until they finally sit down in that classroom and start taking courses. So in the meantime, we do have to find other things to focus on during this long sales cycle before we know, yes, this quote unquote sale or this final top value conversion occurred. So the way we try to do that and to be sure that what we're doing is getting us to where we want to be is to look at a couple of other different things. So the first one is this universal analytics, and this is a little bit of a newer thing in the industry. But basically what this is analytics for everything. It's making it a bit easier for you to track multi-channels, multi-devices, like Eric was just mentioning. It's also going to give you a little bit more capability to loop in those traditional mechanisms and start looking at the overlap for how many people could potentially be touching your brand in a lot of different mediums. Further than that, we also try to measure individual touch points. So, okay, maybe they don't actually end up in the nursing school example. Maybe they don't actually end up going to that school for 3 more years. How many times in that 3 years did they continue to engage with our brand, or did they share information about our brand based off of their PPC experience? Measuring those touch points is something that's also very useful, and you can determine maybe how many touch points it takes to finally push them through to that top line conversion. And then again, I think offering many and multiple conversion types allows you to not necessarily have to gain $1 from a PPC campaign in the healthcare sector in order to make it valuable. So if someone's downloading your PDFs, you've decided to run a PPC campaign to promote a PDF that you've launched on your hospital website that you want people to get more information from. The number of people who download that PDF who maybe would not have if you had not been running those PPC campaigns, that's useful, that's valuable information. So making sure those multiple conversion types are available, measuring all of those individual touch points, providing a separate value for those different conversion types. Certainly someone who downloads a PDF is not necessarily as valuable as someone who truly chooses your hospital to come in and get whatever whatever help that they're looking for. But it's still a conversion. It is still getting you a little bit closer to saturating the market and should be measured just as much. So moving out of the traditional Google, Bing kind of, we call those traditional PPC engines, what else can you do with the healthcare industry in terms of paid search that help you, again, continue to attack the market, to be at the forefront for as many searchers as possible? And something that's really gained a lot of traction in the last year to 2 years is this idea of social media marketing. Now, the actual content side of those things that's more Eric's team and what they're good at. But my team and what we excel in when it comes to these different channels is hosting paid advertising on them. And again, that's even newer than the idea of using these engines as marketing aspects of your marketing plan, period, anyway. So what we can do with Facebook, with Twitter, with LinkedIn is we can very specifically target the kinds of people you are trying to find. So if you're in healthcare education, maybe those people are on LinkedIn and they've already listed out their previous degrees that they've received. And the next step is for them, of course, to get their CNA or whatever the case may be. You can target those people who have some sort of a nursing background within their LinkedIn profile. If we're talking about a potential hospital or a service center, You can very specifically on Facebook get in and target not only by location, but you can a little bit creep out on people's statuses. And if they've mentioned something about feeling ill, I've got really bad headaches, you can target those people and show them your migraine treatment center. So it's things like that that these other engines allow you to do from a targeting standpoint, that while they can be considered just slightly creepy, it is useful. And as searchers get more and more used to seeing these kinds of advertisements and knowing that they are truly targeted towards them for a purpose, the more we're starting to see those engines really kick up momentum and turn into bigger aspects of our PPC strategy and plan for those clients that are in these industries. Eric, you want to go ahead and share some info about how to handle that ambiguous keyword not provided?
Sure, absolutely. And when we talk about ambiguity within SEO, there is no bigger or more prominent topic right now than Google continuing to reel in the keyword data that we get. Now, if you're very PPC focused, what this is when Google sends traffic to your site organically, we can still tell that it's from Google. We can still tell it's organic. We, of course, know where the click landed, which landing page, but in most cases now we do not know the term, the organic term, the query that they use to get there. So how are we dealing with that? And this is one that really transcends healthcare and goes into any sort of business, any sort of site. What we want to do is figure this out. There's a race right now. All the tool providers are trying to figure out ways to approximate this. Bottom line is the data is just not there. So you can approximate it in a fairly sophisticated way, but you don't necessarily need one of these sophisticated tools. If you have them, that's great, but there's a lot you can do on your own. In the next slide, what I show is two different ways to look at traffic. Now, stepping back a minute, we used to talk about the SEO value of keyword-friendly URLs. And we've always taken a fairly cautious approach to that, saying, look, keywords in URLs can be helpful. Algorithmically, there's probably a very small benefit to it. So if you're in a redesign, great, let's do that. But if you have very well-performing URLs already, and they maybe aren't named particularly intuitively, they have a lot of numbers and things that aren't particularly intuitive, but they're still performing well, and you're getting good traffic from them, and you're getting the right kind of visitor, we sort of advise people to leave it alone. The idea of keyword not provided has had an indirect effect on that, because now it is much more helpful than ever to have URLs that are keyword friendly. What this graph represents is, and this is fake data, fake words, so do with that what you want, but I just threw these together. This represents a fictitious healthcare site that is pulling organic traffic into different sections of the site, and the terms in the legend down the middle, ortho, children, neuro, heart, disorders, and homepage, those are all parts that are easily distinguishable when you're looking at landing pages. So you can say, okay, I'm going to create a custom report that shows me segmented organic traffic, and it's going to show me organic traffic to any URL that contains the word children or that contains the word heart. And these just symbolize the ways you could name your URLs in a friendly way to help look at organic performance in the case of not provided. Now, there are two graphs here, one on the left, one on the right. It's the same amount of data. The one on the left shows overall organic growth month to month from, let's say, roughly 660,000 to 710,000 visitors, let's say. And that's a good way, and these are very basic Excel tricks. You can create a chart that just shows the raw numbers here. On the other side, we use each month's raw data, but we group them by percent instead of by raw numbers, so that you can look at the blocks and say, oh, look, on the right side, heart takes up a lot more space in the first month than it did the second. Overall, the percentage of heart is decreased, and our disorders have grown significantly. That way you don't have to kind of account for both percentage changes and raw number changes. So we're recommending looking at landing page distribution by URLs, or by really any aspect that can help you tell what part of the site they landed on. URLs is just one of the most prominent. So we're really advocating an approach where we're looking at this. Where does organic traffic come from and where does it land? And just having to make some assumptions about the fact that, wow, you know what? Our overall, the SEO to our disorders section has really been effective over the last couple of months. What are we doing there? How can we build that out across the same site? So you don't know that bladder disorders or that kidney disorders necessarily did well, although you could theoretically break each of these colored sections down further and say, okay, disorders, how are we going to take that disorders section and look even further there? So there are ways to get pretty darn close to knowing how your keywords are doing. The real negative impact is on the long tail. You don't know how many unique phrases your site brought, but you can get a pretty good overall indication of how your SEO efforts are going from section to section on your site. And this is really one of the top ways we're helping people manage ambiguity right now.
Excellent. Well, that's going to wrap it up for us from a content standpoint. We've got one final question for everybody. Eric and I are willing to give you guys some free stuff if you're interested. So the first one, if you're interested in a Google Webmaster Tools audit from Intro Promote, you can select that option. If you'd like an account consultation with myself and the Hannafin marketing team, we'll put together a solutions blueprint for you. You can also select C if you're in the neither boat and are pretty well set up internally. Or you can say both, and then Eric and I will both contact you to book you.
And Kayla, let me mention, there was a last-minute change. If our offer is a free hour of consultation, we learned that for basic audience needs, it was going to be more helpful if we went this route instead of the Webmaster tools. So it's an hour of consultation on the phone.
Okay, no problem. No problem. Hour of on-phone consultation. All right, perfect. We'll go ahead and we'll close that one out and move forward. That is it, guys. We'll let you go from here and enjoy the rest of your afternoon. Again, don't hesitate to contact either Eric or myself. We didn't get any questions within the webinar time itself, but if you guys do have any questions and you want to reach out to us, our emails are provided there. We'll have the recording up on PPC Hero in the next day or two, and we look forward to meeting with all of you again next month and covering another new exciting industry. Thanks everybody for attending, and we will see you soon.
Absolutely. And Kayla, if for that offer too, if they just want to shoot me an email, we'll get that set up as opposed to clicking over on the URL we have right now. I should have gotten that stuff to you sooner, but yeah, they can just shoot me an email. My address is down there right next to Kayla's.
Cool. Sounds great. Well, thank you guys. Thanks everybody, and have a good afternoon.
Thanks everyone. Thanks Kayla.